I think what we'll do now is just go on to the next session. Is Joe? Joe here? There he is. Hi, Joe. Joe Coughlin is the director of the MIT Age Lab. He's widely respected in this area, has made very significant contributions, and has received very significant recognition. Most recently, I noticed this week he was named by AARP as one of the 9 most influential people in the country of changing our attitudes towards aging.
Does this work? Yes. And so Jack and I wouldn't feel alone. I wanted to make sure I used this photograph to make sure that a few of us had the same barbershop experience together. So thank you so much for having me today. Inviting me to speak today. I see some familiar faces and some friends. I don't want this to be death by PowerPoint. It doesn't look like this is going to work, so I'll stay behind the podium where I usually get a little nervous. So I'd like not to have this be death by PowerPoint, but maybe a little bit more of a discussion, if you will. I want to get you excited by the promise of technology, since you've heard about that already, and many of you are at the forefront of developing those technologies. And then I want you to get a lot more realistic about what the limits to those technologies are. And then ask a question. If all the technologies that are out there are so great and good, and many of them have been around for a very long time, why aren't they in our living room today? And why aren't we all rushing out there to either buy them, reimburse them, or whatever it might be to get them into our lives? So the question is, can we get technology and independent living out of the laboratory and into the living room? So we certainly have lots of stuff in our lab, industrial labs, and other schools. So let's talk about what those things might be, what the new demands are going to be, and maybe what are some of the problems. I think Maj did a great job of talking in terms of some of the barriers out there. I'd like to list a number of those barriers, and being a policy guy at heart and being in Washington and hopefully in this organization advising government, leave you with some recommendations. But you know, as most consultants, the recommendations are, we give recommendations and run very quickly out the door before anybody has to do them. So maybe we can. So let's talk about the population that's aging, and we'll talk about disability in a moment. In the words of Jimmy Buffett, the great philosopher, these are the people your parents warned you about. And so the question becomes, do you really think that all of us in this room, let alone folks that look like this, little ahead of me in the baby boomer curve, but folks like this are going to expect old age as our parents have politely accepted? I mean, think about it. When our parents had a forgetful moment, what did we call it? A senior moment. We gave it quaint names. I want to ask you, do you really think that the next generation of old, people aging roughly, what is it, every 60, 66, every 7 or 8 seconds, are going to age as politely? Do you think they're going to be in focus groups and say, well, you know, it's difficult, but, you know, I am older? I suggest that we are not only the largest generation, but we are also the whiniest generation. So in terms of policy, I want you to think about this as not just a problem set to be solved, but a policy and a political dilemma that is only going to mount with more progression in politics and economics to demand better living tomorrow, rather than just say, we're older, it's our duty and our respect to respect old age and disability as we age. No, this is quickly becoming a market and political driver. So, convergence of aging and disability. So we all have some good news and bad news, and we all know the demographics, so I'm not going to go into that very much. But the fact is, yes, we are living longer, and there are some that argue that we may not be, depending where you are on the economic curve. But the fact of the matter is, we are certainly living longer than our great-grandparents and probably more than our grandparents. Now, I didn't promise that you're going to be living better. What I did promise is that you will be living longer, and you're likely to have at least 1, 2, or 3 more chronic conditions that will lead to a certain level of disability. So 1 American in the United States, at least 110 million of us have 1 chronic disease, roughly 60 million of us have 2, and 20 million pull a lottery ticket of having at least 5 chronic conditions. So that can go anywhere from chronic heart disease, diabetes, asthma, whatever it might be. But this article just came out this week in Boston Globe. It was on a study that was released earlier this year in The Lancet. People are living longer, but with more disability. We've always had a convergence with disabilities and aging. It's not always been clear. They've often lived in two different worlds, maybe under the same policy rubric. But I think what we have now is a real economic and political opportunity combined with technology to rewrite the narrative of what it means to live longer, live better with and without disability by using technology, new business models, and really starting to rethink how we live so that everyone aspires to a certain level of quality of life rather than looking at everything as, well, that's assistive technology. That's for them. If we're successful, all the technologies that we discussed today will be something that all of us will want to have in some way in our home because of convenience, because of care, and maybe if we're really lucky, because frankly, we can make some of this be really cool. So public faith in technology, I would say this is probably one of the larger religions in the United States. If you look at the Futures Group, they did this study a couple years back. Possibilities afforded to us by technology continue to grow, 96%. I know how to use technology to make my life more interesting and enjoyable, 90%. Class participation is 10% of your grade. What age group was this? 60 plus. So for all of those folks talking about the digital divide, do you know what we call technology that older adults cannot use very well? Bad technology. Stop talking about the user as if, well, we've got to work around their needs. No, if you make good technology, it responds to their needs automatically. Remember, the goal should not be to provide additional support. The goal should be to excite and delight and create a level of living that all of us can aspire to at whatever capability we have. So let me give you some of some gee whiz or some stuff that a lot of you probably are working in your own labs. We don't use crystal balls anymore, as we like to say at MIT and other places. But let's take a little picture of what I want to get you excited about of what might be. This is just generally a collage of stuff that's out there. Some of you may recognize some of your own things out there, whether it's a wearable computer, wearable t-shirt from Georgia Tech. Yes, your underwear will be talking to your toilet and talking to your refrigerator and talking to your local grocery store. That is already being done in the UK, by the way, as a pilot program. This spoon that you see there was developed by a colleague of mine at MIT. It's a bane of my existence. It will allow you to monitor the viscosity, the fat content, and sugar content of, say, in my case, the Ghirardelli brownie mix that I'd like to make, and wire it up to either my doctor's call center or, worse yet, to my wife, saying he's at it again, given his great history of family history of type 2 diabetes. For all of us trying to make those blood pressure cuffs a little bit better to use, implantable sensors are a lot closer than we'd like to think, maybe in many cases. And yes, your telephone is going to be talking to a variety of other things. We all know that there's stuff on the market today, and everyone and their brother's got at least one project where the telephone is going to be reminding you to take your meds, call your mother, or to do something else that you should be doing. But generally, what we're looking at here is a great range of technologies that I like to say are, in some cases, in search of a problem. So if it's social media telling you to take your meds, the idea of health being everywhere. This is a windscreen from one of our cars in our lab. The car now manages and monitors your health behind the wheel in terms of telling you what your blood pressure is, your fatigue level, and actually will send that information to you or anyone else that you care to have it sent to. So we're connected, it's smart, and hopefully there'll be some services behind it is where so many of these things are going. Robots are among us, not just iRobot cleaning the house or mowing the lawn, but many of you may know Paro. Paro is in many nursing homes in Denmark, Japan, Italy, and others for Alzheimer's patients. It is a robot that eventually, over time, will recognize your face and your voice and respond to you. This is a receptionist in a Japanese facility. She's not very personable, but she gets the job done. My colleague up above there holding the orthotic is designing the spacesuit for the trip to Mars, David Newman. It takes roughly 18 months. You leave at 30 years old. You come back about a 75-year-old osteoporotic patient. So the idea would be, how can you take a spacesuit and make it possible for an astronaut to wear that, to be able to do all the things they need to do in extreme space? She and I, a number of years ago, spoke and said, well, gee, space may be an extreme environment for astronauts, but your mother's kitchen becomes an extreme environment as she changes and the kitchen does not. Can we imagine wearable computing and different devices and wearable systems that you could wear underneath your civilian clothes to increase your strength, your flexibility, monitor your well-being, but also not be something that radiates old woman in kitchen, which is so much of what our technology seems to do. This wheelchair we have in the Boston home, it's a partnership with a computer science lab on campus. If you need to go to the kitchen, you say, take me to the kitchen. If you need to find Joe, It'll say, take me to find Joe, and it'll use the RFID tag and my ID to find me or where you want to be. We have a vision of high-performance environments. Some would say it's a hallucination. We started it in the car. We figure if we can do something at 70 miles an hour, it should be easy to do it standing still. And the idea is, can you imagine a car, this room, a workplace, a nursing home, a hospital, wherever it might be, being able to detect your individual well-being? Are you paying attention? Are you stressed? Are you fatigued? That's the easy part. But then actually being able to intervene to bring you up or to bring you down if necessary. We're talking about using color, light, smell, variety of other things. This technology is already finding its way into BMW, Audi, and some other products out there. So be prepared very quickly. The home you live in today, the place that you work in today, will start to have far more sensors to be sensitive to your individual performance, which will be ageless and without respect to disability, but better for everyone. And of course, when we think about transportation, we got to think beyond the car. This is Agnes, Age Gain Now Empathy system that we developed in the lab. It replicates basically being close to 80 years old with badly managed diabetes and osteoarthritis. This need not be destiny. It's a teachable moment, if you will, in terms of what could be. The reason why we use Agnes, yes, we use surveys. Yes, we're in the field all the time. Yes, we use focus groups. And you can see and hear a lot by asking and looking. But remember that polite comment I made about older adults and many disabled? The fact of the matter is that when you ask somebody what they think, they often are unaware of what technology can do. So when I put this on the average 20-something-year-old engineer or an average 27-year-old marketing or product developer in a company, they get the aha moment. They feel the fatigue, the friction, and indeed the frustration of opening that bottle, opening a cake box, or reaching on top of a shelf. And they realize in their power they can change this, and all of a sudden it's more than just a quote or a film of somebody saying it was difficult. So I'll give you an example. Here's a pharmacy. Many of us don't think about the checkout counter as being a hazardous environment. Next time you are standing next to a checkout counter and the window is glaring and your eyes are over age 50, take a look at the glare on that credit card reader that you have to use, or being able to reach on a shelf. So we're currently working with a retailer redesigning their store using Agnes, and hopefully by May you'll start to see far lower shelves, things that older adults use that will be in the middle rather than on the bottom or the top, lighting that makes sense, carpeting that is easier to navigate and less likely to trip on. Bottom line is we need, as we think about getting into the technology of older adults and the disabled, we need to have empathy to get into their shoes as much as possible. Getting, as Imaj was talking about earlier, being more user-centric. This is a device, and I'll be transitioning out of devices here in a moment. My students noted one of the things that a lot of people do that do live in a two-floor home or better is that they will buy 1, 2, or 3 canes to pre-position them at different parts of the home. They've developed a walker that can also collapse into a cane, and they're getting the weight down so that it can be one size, shall we say, fits all. And they were using it first with their Agnes suits and then bringing it out into the field later on. So that's just a little picture of in my little corner of the world and what a lot of other folks are working on. There's nothing terribly novel in what I showed you. A lot of this stuff is either kind of on the market, near the market. But I want to use a business case because I want to transition now, not just for what user demands are likely to be and what we need, and the promise of technology, which is indeed great. I would argue that the technology for quality of living is truly, to use Vannevar Bush's phrase many, many years ago, the endless frontier is now quality of life. But let's talk about a technology, social alarms if you're in Europe or Australia, personal emergency response systems here in the United States, the infamous help, I've fallen and I can't get up technology. How long has that been around? Anybody know? Closer to 50. In fact, a lot of this stuff actually started developing even in the early 60s in terms of trying to help people in rural areas, and it got perfected at Boston University and a few other places about 30 to 40 years ago. That's the good news. Does anyone want to take a wild and crazy guess as to what the market penetration of the 65-plus population in the United States who are frail, who need this is? Pick a number. 10%? Anybody else? What's that? 2%. You're cheating. Yes, 2% is the penetration rate. So something is going on here. It's either really hard to use, which somehow I doubt pressing a pen is that difficult to learn. If you're not wearing it, that's part of it. If you're not wearing it, but we'll go on a little bit. It's maybe too expensive, so someone out there is making a decision that their mother's worth less than cable TV. But let's take that as a UK example in terms of it being too expensive. What is the penetration rate in the UK where NHS, the National Health Service, will sign off on it and get it fully paid? It jumps, but don't get too excited. It jumps to 15%. So price might be an issue. But what I'm pointing to is, here is something that is obvious, easy, relatively affordable, makes infinite sense for those frail enough to have, and it's gone nowhere fast. What's going on? Because what I'm worried about as a researcher and as a policy person is I can crank out countless devices. I can't. My students can crank out countless devices. But I see countless devices on shelves. I see them in labs. I see lots of dissertations out there. And I haven't seen one in Best Buy yet. Have you seen one in Brookstone? Do you have to talk? Is there anyone other than a discharge nurse that knows that this stuff exists? What I'm saying is that there is a major, major market failure that I would argue is incumbent on us as researchers and as policy people to take a hold of, as much as it is to convert technology into a new widget, into a thesis, and put it out there and say, gee, what do we do with it? So in preparation for this presentation, I wanted to come up with a number of reasons as well as things I think that we could do to address this. And in policy, one of the big things that most people don't like to admit, especially here in DC where I worked for many years, solutions always bring not just one solution, but bring at least two or three. In Washington, we say challenges. Outside the Potomac, it's a problem. With every solution, we bring at least two or three problems. And these go from, I think, how we're framing or how we're positioning many of these technologies and how we are or are not getting them out there. So let me go through these, and hopefully we'll have a few minutes for questions at the end, or if you have something during as I go through these, please feel free to ask. So here's the first thing. Why is it that we always frame technology for the disabled or older adults as a purely rational act? I have never seen anyone in a shopping mall buy anything out of rationality. We make this entirely as something around facts and fear. You need to eat well because A, you're going to get sick, or B, you're going to die. You know, I grew up in Philadelphia. I think that scrapple, cheesesteaks, and tasty cakes are food groups. All the phone messages in the world are not going to change that unless someone comes up with something equally as tasty as Cheese Whiz, because everyone knows cheese comes out of a jar. The fact of the matter is we're framing many of these devices like the Help I Fall and Can't Get Up and various other systems out there around you're old or you're disabled, you need this, but it's not for the rest of us. Well, that doesn't seem to work very well. Let me take two areas of one, it's kind of a trite example, but it's a good one, and one that's profoundly boring as some of these technologies that they're doing something different with. Apple Store. You feel stupid going into an Apple Store even if you're a Dell user? Well, largely they try really hard not to. They turn it into an education experience. You're not going to ask for help. You're going to the Genius Bar. You're a lot better off than you thought you were. And the idea is really creating teachable moments and places that are fun to go to engage with the technology. Where do we do that now with the technology out there for older adults? At best, the senior center. But the pharmacy maybe, depending on the pharmacist, or in general, it's not even the chain pharmacist. It's the local pharmacist who's decided to take this as their specialty to understand this is a good wheelchair. You don't want this one because of whatever reason it might be. Now, can you think of anything more boring than finance and insurance? I mean, there's a lot of money there, but really. I mean, what's the old joke? Is an accountant is an actuary, an actuary is a person who didn't have as much charisma as an accountant. This is the bank of the future. This is State Farm, and one that looks just like it by ING Direct is really trying to engage people in coming in for a cup of Pete's coffee, quite literally, have a seat by the fireplace and a chair. And by the way, we'll talk about life insurance, retirement, and the like. I know this is off the mark in terms of technology, but what I'm telling you is that we can't just try to push technology as a rational moment and have people just run to it when they're the only ones running to it and we haven't framed it in such a way where it's distant from any other experience they've had in their overall retail experience. Fun, friends, and fashion motivate. Facts and fear scare me, or frankly, as I get older, I just shut down. Consumer jobs. we think that by giving a device that it's all taken care of, that the caregiver is going to feel much better. She's going to be able to go to work and stay longer and not be stressed, and that lower back pain having to do with stress or feelings of depression are just going to go away. Think about the job. Even if you have the technology in your hand, think like Geek Squad. The flat screen TV doesn't move nearly as quickly in Best Buy until Geek Squad came on board. Because here's the other jobs you've got to think about. I've got to select the technology. Who's out there to help me select the technology in disabilities or in aging? I've got to find a way to pay for it. And by the way, even if it's reimbursed, it's a paperwork challenge. Installation, how do I get it into the house? Education, oh wow, how do I use it? And by the way, learn to adopt it and then trust it. Trusted adoption, I'm going to trust this with my mom even though I live at a distance. Oh, and I hate to break this to all my engineering colleagues. This stuff does break. So how do I get it fixed? How do I get it replaced? And by the way, it's going to be renewed. So how do I do this all over again? Whether I'm the adult child, whether I'm the patient, whether I'm the family member. The fact of the matter is, I think Staples has got a great line. Easy. And so far, we have not figured out how to make it easy. The technologies are out there already. They're off the shelf, but we haven't figured these out. I can give you more information than you ever want to know. We've got sensors under the rug that are not going to detect that you've fallen. They're going to detect that your gait has changed and that you're about to fall. Who do I send that to? Joe, you've had 2 cheesesteaks in the past month. I'm going to send that to where? And what kind of information am I going to do with that? Your blood pressure is X. Your blood sugar is Y. There's a fine line between giving data and giving information. I submit to you that the explosion of systems out there now to monitor, manage, and motivate your health and well-being, just on that dimension alone, is going to create an entirely new workload for the consumer, patient, caregiver in a way that we've never even thought of. If we're talking about the adult child caregiver, she, and we know she is she, 47 to 57-year-old oldest adult daughter, is looking for solutions, not looking for data. And I'll be honest with you, how many of you really want one more email on your phone? Do you need a text? Have you noticed what's happened, by the way? The people you really care about or you want to reach, you've taken them off your email and you say, text me. And now that's gotten overloaded as well. So I love the systems that many of my colleagues are responsible for making that are giving me more data, rather. Very few of them are giving me information, and even fewer of them are connecting them, if you will, to things services that I can do with it. Do you trust the cloud? Do you trust the cloud with your mother? And I think this is a huge issue. And I was talking to one of your colleagues here in the room in consumer protection. I think that we are about to enter a whole new generation of debate around liability, safety, and risk. Think about this. We are now going to have to demand a far higher state of reliability for our most frail and our disabled. Wandering, we can't have a system that is good enough for maybe kids that are only going to be in the house, or the dog, which is where many of these technologies are being developed from. And by the way, forgetting to take medication, depending on what the medication is, may be a very tragic outcome. This is not just about kicking out aspirins and maybe a few beta blockers. The other question is, too, is are we going to reach, as we know in transportation, what we call safety homeostasis? Now that I've got so much technology in mom's home, well, I used to call twice a day just to make sure she answered the phone and wants to say hi. But frankly, maybe I need to call less. Is there a chance that the technology will actually create a greater social isolation than we expected, but also the safety homeostasis we saw on the roads years ago? I've got an SUV, you've got a VW, get out of my way, or doesn't matter. And frankly, in the law, and I'm getting outside my own bandwidth here, but in the law, particularly in liability, there's something called the reasonable man standard. And I'll make it short because that'll, shall we say, exhaust my entire knowledge. But my understanding of it is that basically in the law around liability and other questions, you ask the designer, the product team, whoever's offering the service or product, did you design this? Could a reasonable man expect X? Whether it's a slippery sidewalk, a technology, and the like. Well, generally speaking, I would argue that the reasonable man, and I can say this is true in the automobile industry, is a 27-year-old, 165-pound, 5'10" male. But now that the population is increasingly becoming a 67-year-old woman, short, frail, and has about maybe 3 or 4 chronic conditions, do we need to rethink the reasonable man standard? do we need to have a new level of reliability, a new level of liability, and a new level of how do we actually get these things in people's home and manage risk? And by the way, this is real. These are some headlines from just last year in Massachusetts. The folks that have to use many of these technologies are not entirely sure how to use them. They get used to listening to the alarms so much that you hear the bell go off, oh geez, that's Joe over in 4A. He's always probably ringing it for another cheesesteak or something like that. But basically what happens is people start to unhear, not hear the alarms, not pay attention, and unfortunately we have death as a result. In the extreme case, but in many other cases, we start to rely on the technology so much that one less time of looking in face-to-face may result in a bad outcome. Inadequate community-based technology supports and services. Where on the ground, even if we had these technologies available in the shopping mall or wide distribution or given out by the hospital, where is the community-based network that A, knows these technologies exist, and B, knows how to use them? I love the area agencies on aging. They're angels and underfunded angels. Let me ask you a question though. How many of them are technology savvy? Many are not. There are 300 plus of them, and that's about how many varieties we have in the area agencies aging. And I would suggest, by the way, even the VA system, which looks like one standard system, wow, the range of variation within that region, those regions, is dramatic in terms of who knows about technology and who does not. There's some innovations out there being done in aging, in particular, Beacon Hill Village, this virtual retirement community idea. Increasingly, we're starting to see technology move into that as maybe a locus of expertise and distribution. This is where folks say, hey, I want to age in place in the suburbs, or in this case, Beacon Hill in Boston, and I want to have a virtual retirement or virtual assisted living community. But we really need to get expertise out there so that there is support beyond the sales and beyond the call center. Now, Jack, when you opened the session earlier this morning, was talking about the changing demography of caregiving. He put that to a very fine point, but I want to reiterate it on something else. Not only do we have a caregiver shortage, because remember, our parents had 3.9 kids, most of us had 1.9 kids. So even if you have a kid, she is likely to be living at a distance or more likely than not to be employed. The fastest growing house in America is not this USA Today level discussion of people moving back in with their parents and watching video games at age 40 in the basement. In fact, the fastest growing house in America is actually a woman over 65, 43% of them living by themselves. So the question is, we need these services because frankly, there's not the daughter, the son, or the son-in-law or daughter-in-law necessarily existing or within range to come over and tweak the device, tweak the system, or to ensure that the system is there at all. Empowering practitioners. This is probably going to make it difficult for me to find the exit later with my colleagues. But you know something? A lot of the best ideas are done by people who do the work every day. Look, I love research. I think the world of the people I work with. But at the end of the day, the people who really understand innovation. By the way, anyone want to give me a definition of what innovation is? Because we're talking a lot today about inventions. I'm going to steal from the art school up the river, Harvard. Innovation is putting practical ideas into use. So when I show you all these widgets, they're really cool toys. But until they're in your living room, it's not an innovation. And the folks who have done, I think, the best job at innovation, who truly understand the problems around aging and disabled, are those who are working and living with the aging and disabled community. So I'll give you an example. This gentleman, not this gentleman here, but the gentleman who developed this system to be able to get out of bed more easily, has been trying to get my attention to help him get attention to this device, which is very cheap, easy to set up, but he can't get enough visibility because he's just one guy in one corner of the country that has a great idea that has no ideas, has no distribution associated with it. Other idea over here, I'm not sure how great it is, but just, I talk about grandeur, the idea of bringing essentially a nursing home to the house and make it into a service opportunity rather than necessarily something you have to go to. It may have problems technically, it may have problems as an idea, but that was developed by people on the ground actually doing it and was distributed throughout Rhode Island and has gone since, has not gone anywhere since, largely because a university can get a lot of get a lot of traction, large organizations get a lot of traction, but how are we harnessing the people that are actually in the field? And then lastly, and this is huge, I mean exceedingly huge, and it was mentioned a moment ago, but I want to reiterate, new technology demands an entirely new workforce. You know, I teach a course that's offered over at Harvard Med School to third-year students. And I have to tell you, until we can get telemedicine to be just called medicine, it's still going to be that something new and different, because it's not part of their ritual, not part of the day that they get that white coat to know, I'm a doctor. By the way, being a doctor means I touch the patient and I see the patient. And those kids are still graduating in 2012 and 2013. So until we can really get into the workforce to start thinking about how we can distribute these things and get it into the professional code, I'm not entirely sure it's going to be widely adopted. So I'll give you an example. The medical home model. You know, Dr. Welby, I hate to tell you this, but Dr. Welby's dead. And for those of you who don't know Dr. Welby, you're too young to worry about it. Anyway, we have this notion that the medical home is going to be a great idea. And perhaps it is. But you're turning this doctor into one heck of a systems integrator. With all the data in the world that we're now going to be feeding he or she, it's going to be very interesting to see how that office and how that individual is going to be able to act on that and send it out. What's the call center of the future going to look like? Is it going to be a bunch of tired, stressed out nurses as we have today? Or is it going to be something different with a lot more data and a lot more information out there? I think we're going to need a whole new profession out there, whether it's health data coaches or something in between. Something that's somewhere between clinician and someplace between data. We don't have it yet, and there's no academic program out there. And how in the heck do we distill the petabytes, let alone gigabyte and terabyte, the petabytes, and visualize and come up with some meaning as to what the data mean? Grandma didn't eat breakfast today, or she ate it later. Well, does that mean she was out partying late, or does that frankly mean that she just didn't feel like eating that day? How do we get meaning out of all this issue, out of these different technologies? Let me end, as promised, with just a few ideas, not necessarily in order of priority, recommendations. And I'm going to put Jack on the spot. Jack, you may not remember this. You and I first met the day you became a CEO. You walked into the White House meeting that was just like this on the same topic, academic physician, and then walked out as CEO. I don't know if that was 97, 98, when that was. But here's my question. I'm not entirely sure how much progress we've made in that 10 to 15 years, whatever period that was. And I'm as guilty as I think everyone else is, because I've been working in this field for a long time. And so my observations over that 10 to 15-year period of talking about the boomers are coming, my God, they've been coming for 60-odd years. Let's talk about where I think the problems are. We need to think more beyond, we need to think beyond the Small Business Innovation and Research Program, or SBIR. I think we need a new agency. You know, I love the folks over at NIA and NIH, but remember, bureaucracies are created based upon yesterday's definition of the problem and yesterday's definition of a solution. I need an agency out there who's going to champion not just getting innovation out there, but is going to make sure that there are data sets available, there are test beds, certifications, a convener to get business in the room, because frankly, until it's in Brookstone and Best Buy and the like, a lot of people are never going to know it's going to be here and not even be able to use it. I was mentioning to someone at the break here a moment ago, do you know that in 1 year, Brookstone is going to make 80% of its devices medically inspired? So when people start looking for solutions, I think I know where they're probably going to start going. We need another part of research. I love the engineering community. I love the gerontology community, but there's a gap. We need to start funding or stimulating business research. And I'm going to bring in that nasty word that we don't think is real science in many quarters: marketing, product development. We need to take an imagination to invention to get it out the door. Launch a nationwide education initiative linking tech development that we have in many of the same universities with the service professionals that are out there. One of my students did a master's thesis 3 years ago, so the data is 3 years old. She looked at the top, we just used US News World Report just as a benchmark, the top 20 schools in gerontology, medicine, social work, essentially the caring professions. How many of those programs had a course where their curriculum included technology, like telemedicine, anything? Any guesses? 2 schools, 9 courses. Even the schools that have amazing programs in developing new technologies never walk across the aisle or across the hall to teach them to the nurses, social workers, gerontologists, or the docs. This is my last page of recommendations. Facilitate, it's back, by the way, for those of us who remember the Clinton administration, public-private partnerships. We don't have anyone out there that is a smart buyer guide. How would I know what to buy if it was put in front of me? We don't know what systems and services exist, let alone the ones that we should be trusted. So we need to create some sort of gray area between government, business, and the consumer to vet what these things are going to be. Ensure technological equity. I guarantee that all this stuff is going to get cheap enough for everyone to buy, but not in the short term. I was one of those dumb guys who bought a PC in 1985 for $5,000. Develop a legal framework now to address the issues of risk, privacy, and data ownership. So let me close on the following. This is what we really need. We need leadership, urgency, and action. I submit to you, and I'm going to find the exit because my research colleagues will kill me when I say this, I genuinely don't believe we need a bigger chunk of change to do more research. It would be great. There's more things to be done. The frontier is truly endless. What I do not hear is a dream, a voice, a call to action that says all of us with any luck will be older. All of us, as the literature says, are temporarily able-bodied, to have a vision of quality of life and how to leverage the political demand, the economic opportunity, and the technology to make this not just about the old, not just about the disabled, but all of us. And I throw President Kennedy up there because he had the inane idea of going to the moon. And maybe we got there because he said we were going to go to the moon or not. But I got to tell you something. Technology does not just happen. Engineers need a requirements definition. And to date, there is not an agency, there's not a policy analyst, there's not a writer, or anyone out there who has invoked the passion to say, we need to live longer, we need to live better, and we need to do it today. Thank you very much.
Thank you, Joe.